Anorexia nervosa and neuronal linkage. Anorexia nervosa is not just about refusing food, it's a brain body disorder. Deep inside the brain, appetite circuits in the hypothalamus reward pathways using dopamine and emotional centers like amygdala becomes disturbed. These neuronal changes can alter hunger, fear of weight gain, body image, and decision making. So, in anorexia nervosa, the real battle is not only with food, it's also with the nervous system controlling hunger, emotion, and self perception. Hi, my name is Dr. Wes, and today we're going to discuss anorexia nervosa and neuronal linkage. The core concept food cue, the fear circuit, control circuit, reward circuit, and starvation loop. These are all involved in anorexia nervosa that involve restricting food restriction, fear of weight gain, body image disturbance. Neuronal linkage that involves hypothalamic appetite circuits, insula, amygdala, and prefrontal control and dopamine reward pathways. Treatment might be psychotherapy, food support, medical monitoring, and relapse prevention. Disease description. Post-psychological features include intense fear of weight gain, body weight, shape, may have excessive influence on self-evaluation. It can occur in adolescents and adults. Clinical features: low weight, restriction of food, electrolyte imbalance, body image, distortion, over-evaluation, bradycardia, hypotension, anuria, electrolyte problem, and bone loss may be there. Subtypes: restricting type, no regular binge eating or purging behavior during recent months. Binge purge type, vomiting, laxative misuse, or diuretic misuse can be there and produce severe electrolyte disturbance. Complications: cardiac, endocrine, bone osteopenia, osteoporosis, GI, neurological, brain energy, stress, cognitive slowing, irritability, or dizziness. The mechanism: genetic, psychosocial risk, body image concern. The patient get more concerned about the body image, food, weight, fear, restriction behavior, restriction to his or her own self, starvation state that affect the reward control, reinforcement or reward system, persistent illness loop. Rigid use or rules and perfectionism strengthen the behavior. Metabolic loop, ghrelin and stress hormone may rise, but hunger signals are poorly interpreted. Neural loop, insula, amygdala get involved, and sometimes their signals get misinterpreted. Neuronal linkage, food cue, insula involvement, amygdala, fear, anxiety, hypothalamus that releases hormones for the hunger, and striatum including the dopamine and reward system. Prefrontal cortex, cognitive decline is there in the patient with anorexia nervosa, and restriction maintained get the situation of the patient worsen. Hypothalamus ghrelin may rise but does not normalize eating behavior. Insulin and glucose availability fall with restriction. Stress axis, HP axis, hypothalamic pituitary axis activation can increase cortisol. Cortisol may raise the glucose level in the body without eating. Stress can intensify avoidance of eating. Low GnRH and LH-FSH sex hormones can be affected, causing amenorrhea. Thyroid hormone adopt conserve energy. Weight restoration is central to endocrine recovery. Reward fear circuit, food cue, amygdala threat response, anxiety rises, and anxiety may be due to the OCD or other complications of the brain uh, in the patient, restriction, and temporary anxiety relief. Dopamine and striatum in anorexia nervosa, food reward may altered, while restriction, weight loss, or exercise can become reinforcing. Serotonin that causes anxiety, mood, impulse control, and optionality. Starvation changes neurotransmitter availability and may worsen rigidity. Starvation affects severe restriction causes low glucose, low electrolytes, that causes low fat stores, brain energy stress, cognitive and mood changes or cognitive decline and mood decline, and medical instability. Diagnosis, good diagnosis or clinical assessment, weight history and growth chart in the children and adolescent, psychiatric comorbidity like anxiety, depression, OCD traits should be monitored. Medical assessment, uh, labs, ECG, vitals should be monitored in the patient with anorexia nervosa. Risk stratification, look for dehydration, syncope, hypoglycemia, and electrolyte abnormalities. Treatment and nutritional rehabilitation, patient should be rehabilitated towards the food and reinforcement of the food should be there. Nutritional restoration improves brain energy, hormone, and treatment engagement. Psychotherapy, CBTE, or eating disorder focused therapy is commonly used in adults. Target fear of weight gain, body image beliefs, rigid rules, and avoidance. Medical and psychiatric care, ECG for medical monitoring, treat depression, anxiety, OCD trait, and sleep problems. Treatment mechanism, safe nutrition restoration, leptin hormones recover, that causes the brain energy improvement, reduced food fear may be reduced, new eating learning in the patient should be uh, there or should be started. Reward body signals restored and normalized, and relapse prevention should be there in accordance with the physician who is providing the medical facility. These are the few factors that are involved: nutrition and rehabilitation, repeated sport, cognitive therapy, family and social support, long-term relapse prevention. Prognosis, good or better prognosis, early recognition, shorter duration, family involvement, steady weight, treatment of anxiety, good therapeutic alliance, and access to specialist eating disorder services. For a long duration, severe malnutrition, comorbid depression like OCD, trauma, substance use. Anorexia nervosa is a serious brain body eating disorder. Disease behavior should be evaluated for food-related fear. Neurological include hypothalamus, insula, amygdala, prefrontal cortex, striatum, and neurotransmitter like serotonin and dopamine. Treatment requires nutritional rehabilitation, psychotherapy. Uh, Prognosis improve with early detection, weight restoration, and strong support. Thanks and regards. Please like and subscribe this channel for further discussion on rare diseases. Thanks.